Good morning from Philadelphia. I'm here with Dr. Jackson Kirkman-Brown from the ESHRE Special Interest Group Andrology. Hello, Jackson. Jackson, you are chairing today at the ASRM Congress. You're chairing and speaking at the ESHRE Symposium, which title is Looking Beyond the XX Factor. Does that mean that we've been looking too much at the female factor in reproductive medicine?
Yeah, I mean, what we're really saying is that we've spent a lot of time looking at female factors, but when we're thinking about everything from conception, but more importantly onwards, through a healthy pregnancy, live birth, and the next generation of healthy children, these all have male factors as well. There's evidence accumulating, and we need to start looking at that and thinking more about how we guide patients.
Okay, so can you tell us a bit more about this existing research?
So there's more and more data that suggests sperm DNA and potentially sperm DNA fragmentation is a really important cause of miscarriage. So actually after dad has got mum pregnant, there's a key role for the man there. His sperm DNA quality has to be high enough to avoid miscarriage. And then data going on through the life of that child that talks towards dad's health at the time of conception, affecting whether that child's likely to get diabetes, have other metabolic problems. All of these things actually link to dad and potentially even through to grandfathers and what happened to them.
Wow. So what do you think we should do next then?
Well, there's a desperate need for more research in the area. Generally, male research has been quite neglected. We need to go back to that and take a serious look. It's important for our economy, the health of the individual. So all of that points towards more research, but we also need to take more seriously thinking about dad at the time of conception and thinking about things that dad can do towards having a healthy child.
So is this something you're going to talk about today at the symposium?
Yeah, today we'll be covering the evidence as it stands and talking about maybe some things that people will want to look at in the future and consider in their treatment, care and practice. The symposium is something for everybody. They could be nurses, they could be clinicians, they could be scientists working in clinics. And the idea is that all of them get a bit up to date with what they might want to think about for their patients.
Well, thank you very much. It sounds very exciting indeed. So I invite you to join Jackson this afternoon at 4:15 in room 107AB here in Philadelphia.